remember I was talking to you about this different color kantharis? The red, the green, the yellow, the orange, and the purple kantharis that I was talking to you about. And now we have amongst us a green kanthari. You can bite, remember I said, you can bite a green kanthari, and it's pretty sweet in the beginning, and slowly you can feel the fire. And now we amongst us have a green kanthari who is from Uganda, a very warm, compassionate, and a very fiery person. Let's welcome Patric Kyaligamba from Uganda.
I'm Patric from Uganda, Midwestern part of the country. Uganda has 15 million children under the age of 14. 2 million children out of 15 are malnourished. 80% of malnourished children come from the rural areas of Uganda. The problems associated with malnutrition include mental retardation among children, death before the age of 5, stunted growth because of retardation and underweight, and some children don't go to school because of slow reasoning that which they get right away from the tender age. Therefore, I want to start a nutrition program that is called GROWELL. GROWELL is calling for growth that is going to empower children and their families on how to manage, own, and sustain their health through adopting a preventive approach. The government of Uganda has introduced hospitals, it has health centers, but it is looking at the symptom rather than the cause of the problem. This is going to be the first kind of a program in the district where I come from that is going to focus basically on malnutrition, that is going to focus on children and their families, and that is going to promote a preventive model in the rural areas of Uganda. Let us see what is happening in the rural Uganda.
In Uganda's remote region of Karamoja, 2 out of 5 children under the age of 5 are malnourished. Lechoto and Francis suffer from acute malnutrition. 1-year-old Lechoto has developed skin rashes and edema, which makes his body swell due to water retention. 2-year-old Francis's body lacks calories and proteins, and most of all, energy.
Uganda has one of the highest death rates of children in the world. An estimated 140 out of 1,000 children die before their 5th birthday.
It happens that here in Uganda, there are a lot of preventable diseases that affect children. You may wonder about if 5 children were born, then at least 1 or 2 would die before the age of 5, and they die because of preventable diseases.
Preventable diseases like malaria, HIV, AIDS, and malnutrition are common. Healthcare facilities are limited and many kilometers away from small rural communities.
That situation reminds me of my personal story. when my mother used to carry me on her back at the age of 1, walk for over 20 kilometers to reach the nearest health center. That was a sad situation she faced because I was still young. And when she told me that, I too felt sad. But my sadness triggered me to study a course that is related to public health, such that I can go and save the younger brothers and sisters who are suffering, who die before the age of 5. I attended a course in public health, that is, I became a health educator because my mission was to become a doctor, such that what my mother faced should not be faced by any other rural Uganda. I could not make it because of financial constraints. Nevertheless, that I didn't become a doctor, I became a health educator and worked in the rural areas of Uganda, and mostly in the district where I come from. I was attached to a program of community hygiene and sanitation, that is, helping people to learn, to understand that you need to wash after visiting a latrine. You need to have a bath shelter around yourself. Helping people to understand the concept of personal hygiene and sanitation. That was the work I was really working in the rural communities. Interacting with families on problems associated with rural community health. When I was interacting with families and different individuals, I then realized that the same situation still exists. I asked myself, when would this situation end in the rural Uganda? I could not get the answer there and then, but that's when I heard of Kantari, that is empowering social visionaries. I applied via the website, and I came to Kantari. When I came to Kantari, it empowered me with skills on how to face social challenges and helped me to structure my thinking. So in the process of looking at how can I improve the situation of Uganda, that's when I realized that can't I be the one who can change the bad health conditions of rural Uganda? Yes, I believe I can. Therefore, I want to start a nutrition program that is going to raise awareness in the rural areas of Uganda. One on dangers of malnutrition and the importance of balanced diet. The biggest problem the rural communities have, it is not that they don't have food, but they lack awareness. This program is going to achieve this mission through conducting intensive health education and outreach program in the rural areas of the district where I come from. The program is going to create a sustainable mechanism of preventing malnutrition through organic vegetable growing campaign. This will promote a good balanced diet among rural communities, because if they have food, they have all what is necessary. They have got awareness. What do we need now to have is the food supplements. In the hospitals in all hospitals around the world, there is no medicine for malnutrition. They will say, you need food supplements. I'm going to empower younger children, 0 to 10 years, to participate in nutrition activities that will prevent ill health problems and create an ownership of the program. Why did I look at the age 0 to 10? 0 to 5 years, children are under the control of their parents and the caretakers. But 6 to 10 years, these children can be given a concept of personal hygiene. You can transform, can give a concept of nutrition, and they also participate. This will be done through drama activities that will not only look at entertaining the community, but giving a health educative message through drama. Drama will be used as a way of mobilizing communities for action. Communities to come and address the problems that are faced among the rural areas. What do I see and what is the big impact of this program? I want to see a rural Uganda empowered, healthy, and taking the responsibility of their own health. What is the vision of this program? I see a rural Uganda conscious about the importance of good, balanced diet. I want to see a healthy community with good hygiene and sanitation environment at household level and community level. I see empowered children of Uganda participating in health and nutrition activities that can prevent the high rate of malnutrition in the rural areas of Uganda. Remember, to have a prosperous nation, children must be healthy. Let us see a new perspective of a rural Uganda.
Chiri nemesa mukwano okuberanga nawe nakwagalanga forever omukwano gwaffe nze nawe teguyikendera kagibe emyaka bukadde kulibeera mu bwa forever twagalane tulumye n'abo ababitamwa ffe twerage tusaliza babatugerera bamala na budde waabwe n'omukwano gwatondebwa. Hey, hey, your love is my love. Omukwano gwo gwe gwange, my future, your future. Ebiseera byo bye byange, your love is my love. Omukwano gwo gwe gwange, my future is your future. Kuno kunsi ze nawe tuli ku mission yemu ey'okweyagala tweyagale ab'ennugu baffe tubagambe ze nawe ze Romeo gwe Juliet abatatwagaliza bangi abantuko batwogerera binyifafa kati manya.
Remember, you are what you eat. Thank you.
So, Patrick, thanks for sharing a great vision for an entire nation. Just very quickly, can you tell us, we saw the vision, and we saw your basic action plan and the key areas such as organic vegetables, etc. But in terms of numbers, can you tell us how many people, how many rural children it's going to, GROWELL is going to cover, let's say in the next 3 years, 5 years, and 10 years?
For the first 1 year, the program is going to cover 100 malnourished children and their families. These are the target group that I'm going to focus on for the first year. Then when the program goes on, we shall be extending on until we see that we have covered most of the rural areas in the district where I come from.
Patrick, I could see 2 or 3 components of your project, that you are focusing on malnutrition and then balanced diet and preventable diseases. So how do you connect this organic farming, the process of organic farming? People need to own it up. And how do you connect it to the health services or the clinic you are planning to?
Well, for start, I'm going to make sure that we have vegetable growing around household. These households will have the ownership of vegetable gardens in the sense that they can have a good balanced diet. That's why I want to control malnutrition through using an affordable mechanism, affordable resources available, like a vegetable growing, which are one, cheap, and easy to grow. We have land and we have fertile soils, which can support all kinds of vegetable growing.
What about the clinics? I'm asking about the connectivity. I'm asking about the connectivity of the organic farming process and the clinics on the other side.
The clinic as well, that is the bigger plan I had all before I came to Kantari. But for now, I'm going to begin with looking at outreach and awareness program. But of course, that is not, I looked at, it is not a very sustainable way because I would almost be duplicating what the government is doing. And now, my approach now is looking at a preventive model rather than the curative approach.
Thank you, Patrick, for your interesting idea. Just one question regarding, you said, just now you said you are looking at the preventive approach, and also you said you are looking at symptoms rather than going directly to means of curing it. My question is, the issues of health cannot be addressed with a very narrow perspective. So what will be your holistic approach towards health? Is there other issues, other what you call issues of your country, issues of cultures, are related to each other? What will be your holistic approach towards addressing communities in terms of health?
I'm going to adopt an integrative approach. That's why I have health versus agriculture kind of farming, small kind of farming. This approach looks at addressing a problem in different way. Like if I say I'm going to use vegetable growing as a way of controlling malnutrition, that is an integrated approach. Two, I'm going to adopt a participatory way of owning the program. That's why I want children and their families to participate in these activities, in health and nutrition program within the rural communities.
Thank you, Patrick, for your presentation. I like the idea of combining education with growing or teaching people to grow healthy food. Could you elaborate a little more around the causes of malnutrition? Because it's, as you presented, a big scandal in the world still, that 1 out of 3 children who are dying from malnutrition under the age of 5 die due to malnutrition.
Yeah, some of other causes of malnutrition include poverty in rural areas. That is one of them. That poverty is also one of the causes of malnutrition, because some of these families don't have the capacity to sustain a good balanced diet within their family. Then 2, there's the issue of HIV, whereby now the rate of HIV has grown high in Uganda. So some of these younger children, they are left as orphans. So when they are left as orphans, it becomes hard for them to source the best food or what they can do for their lives. And of course, the other thing is lack of awareness, as I told you. Because the communities, in the rural communities, they need to be aware of the problem. Some of them, they are not aware of the problem. They need to be shown the dangers of malnutrition, just within their family and among their children.
Thank you for the answer. I just want to to know, how do you recognize malnutrition, or what are you teaching them about danger signs of malnutrition?
May you phrase the question?
Well, actually, there are some easy tools, and it was presented a little bit in the film of yours. Have you heard about MUAC? It's a mid-arm, upper arm circumference where you measure the upper arm of the child, and if it's below a certain
Of course, that is one of the aspects that I have to look at. To look at the like sticks, of which look at the one which is put on arm, to measure the body, the height of his arm. When it shows red, then you understand that this child is malnourished. And the two, it is not something that which is very easy to go and pinpoint a child that you are malnourished, but there are some signs which you really see, like underweight. Then the growing body, you see that kind of stomach really coming up. So then you see the running hair running away just from the head. So you understand that there is a problem of malnutrition.
Yes, and another easy tool is, of course, to weigh the kids and see how much it differs from what they should weigh at a certain age. But this MUAC, again, is a very easy tool to measure the upper arm, and if it's below 16 centimeters, then it's very dangerous, and you should actually take action and maybe send them to a hospital. And I think it's very important in rural areas where maybe there's no doctor to teach people what to look for, so they know when it's very dangerous. Thank you.
Thank you.
One last question. You said you're dealing with children from 0 to 10 years of age. What do you actually advocate to parents within the first year of life? Because it's very important.
The most important thing is hygiene and sanitation around their home, and the personal hygiene. Yeah, that is what I'm going to first look at. Then as we integrate the issue of vegetable growing within the program.
Do you also teach about the importance of breastfeeding, for instance?
Yeah, of course, in the area of health education, that is also one of the issues that I'm going to be conducting intensive health education activities. And that deals with breastfeeding, how to bring up a kid, how to do so that's part of it.
Because especially when you don't have access to safe, clean water, it's important to breastfeed the child, at least for the first year. Yeah.
Thank you.
Thank you.
In continuation with the questions, just one more clarification, or maybe I don't know how do you put it. You said about sensitizing. Awareness programs and dramas are one of the main things that you have proposed. And maybe I would like to go back to how do you link the issues of the symptoms? And you said the causes of malnutrition are poverty, HIV, those kinds of issues. That's what I was trying to ask you. How would you like to link these issues and put up in a perspective of health? How do you like to link these issues and try to put up in what you are trying to address to the community? And one more thing is, how do you, you said you want the community to own the program. How can a particular community own the program without access to resources, without access to power? How can a community own? It's a very innovative idea, but how can a particular community own? How do you work up ideas, or how do you work up methodologies so that there will be a process that the community will own it, the process, and it will benefit them in a long term?
Ownership, that's what I'm going to begin with. Ownership, I'm going to have community health volunteers. These volunteers will come from the rural areas where the program will be operating. They will help in mobilizing communities. They will help in monitoring some of these activities, and they coordinate with the program such that in case there is any response, any need that which needs the intervention or serious intervention, we go in. And sometimes these health volunteers, they help to report some emergency cases within the program. So in ownership, community health volunteers will be part of this program. Then how am I going to link up the other causes of malnutrition with the program I'm going to run? As I've told you that an integrated approach is a bit large, but there are some clear steps that you have to take. One, when I'm integrating vegetable growing and poverty, there is the link that when a home or a household grows vegetable gardens, it will save the money that it would have taken to Patrick, who is standing here. So that money can improve the other conditions within the household. Then the issue of HIV and AIDS, it is a big problem, and that is a global challenge.